Hi, welcome to Freedom Pilates. My name's Cath. I'm a physiotherapist and Pilates therapist. Just wanted to go through a few of the differences between our clinical style reformers and our fitness style reformers. On my left here, I have a clinical style reformer. It's the Odyssey reformer with the high leg extensions. On my right, I have the Dream reformer. The key differences that I look for in a clinical reformer, first and foremost, is the height. You'll see here that the Odyssey reformer has these leg extensions here to bring it further off the ground. This is really key in a clinical population. For people with back pain, with knee injuries, the simple act of having to get down lower onto a reformer can be a real barrier. It becomes really effortful and can be really the key thing that makes them think, I really just find it too hard to get on and off my reformer. So we really look at going for those higher style options for the clinical population. The second thing that I look for in a clinical reformer is one that has a little bit more softer padding, such as this one with the Odyssey. For people with clinical injuries such as back pain, hip pain, I will often be focusing on getting them to release tension. So laying down on a softer surface will often help them to be able to really focus on letting go of that excess tension, as well as for exercises such as kneeling. If they've got knee pain, it's much more comfortable to be on something slightly softer. Now, having said that, the firmer surface such as this one on the Dream becomes really quite helpful in a more fitness-based orientation, because you're more likely to be doing something like lunges, much more dynamic activities, where a softer surface can be a little bit more challenging to keep your balance. So the firmer surface can be really great for those that are wanting more of a fitness-based workout on their reformer. The final thing that I look for in my clinical reformer is the orientation of the shoulder rest and the head and neck rest. The clinical reformer here tends to have a slightly wider space between the shoulder rests, and the head elevation on the head neck is slightly further back, and I tend to find this is really helpful for anyone who has head, neck or shoulder pain. It's not something you're going to notice any difference with the fitness reformer if you don't have issues in this area, but for those who do, really do notice this is a much more comfortable position to lay on. And because once again in the clinical population they tend to spend much more time laying down on their back doing exercises, it can be a really key factor when you're actually doing those exercises. They're just a few of the key points. Obviously, when it comes to choosing a reformer, it really isn't about one being better than the other. There will be a certain number of things that really make the difference for your individual experience. So if you have specific questions about what you need and what's going to make it the best reformer choice for you, please reach out to our team. We're always happy to help.